name is Dr. Bagchi, eye specialist. Today I will be talking about a very rare conditions of the eye disease, which is called low visions. Now let me tell you one thing about the low visions. Low visions is not blindness. Blindness is totally the non-perceptions of light even. Low visions means there are some certain systemic disease conditions like diabetes, hypertension, as well as some eye disease which is called glaucoma or retinitis pigmentosa, which we normally call night blindness. Due to all of these, we have impaired visions. That means majority of our visual acuity gets lost and there is some residual visions which is there. Now, low visions is the conditions where your residual vision is remaining and the majority of your vision is getting impaired. Low vision aid is the mechanism by which we use this residual vision to get it increased and your visual acuity increases with these low vision aids. Now, how the low vision aids helps? Let me tell you one thing. Once a person have low vision, that cannot be improved with spectacles as well as surgery or any medicines. Hence, people continuously suffers absolutely blurred vision, less contrast sensitivity of the visions, night blindness and all of the factors which affects the life a lot. You cannot do your regular activities properly. Low vision aids are a very good mechanism by which we increases your visions at your retinal level by an optical illuminations or optical magnifications, by which the contrast sensitivity increases, your visual acuity increases and hence you can see the object very brighter and clearer on the retinal level. Low vision happens due to some conditions of systemic diseases. Diabetes and hypertension are the major cause of the vision loss in your eye. Diabetes and hypertension actually give a thrust to your retinal vessels and it get burst, which we call venous thrombosis or diabetic retinopathy or hypertensive retinopathy. Besides, glaucoma is one of the major factors by which your optic nerves get damaged. Once these optic nerves get damaged or the vessels get damaged, your visions absolutely permanently gets impaired. Now, what will you do with these impaired visions? Low visions aid helps in utilizing these residual visions to a maximum level. There are many patients whose visual acuity after this diabetes or hypertension or diabetic retinopathy or hypertensive retinopathy becomes 10%. Now with the low visions, even this vision can increase to 100% depending on the impairment of the visions what is there. 80 to 100% of the visions recovery can be done only with the low vision aids. Low vision aids are different types of instruments. It can be in the form of spectacles, it can be in the form of CCTV camera, it can be in the form of dome magnifier, it can be in the form of total computer systems and all. Depending on the conditions of the patients, we used to prescribe, we used to give trials and we prescribe. Now, how will you get to know that you have got low visions? In that case, you have to go for a consultations. We are very happy to announce that at Nephrocare, we are actually introducing this low visions consultancy. If you go for this consultancy, we will be able to diagnose what type of disease you have, what type of vision impairment you have, and how it can be prevented and what are the aids which will be needed for you. So, I feel you all do not miss this opportunity because this is a very rare type of consultancy available all over the India. And thanks to Nephrocare that I have been privileged to give this consultancy over here. So I would actually like to invite all of you to get this advantage and come to Nephrocare for this consultancy. Thank you so much.